Hello everybody, my name is Felicia. A lot of people know me as Flip. I am 30 years old. I currently live in Miami, Florida. I'm married with 3 kids and I have decided to do a video journal because recently I was diagnosed with cancer for the third time. So my husband came to me with this idea of doing a video journal, and at first I was like, no, I didn't really want to do it. But after some talking, I felt like I would have a lot to offer other people that may be going through something similar. I do feel like I am connected to other cancer patients, especially because this is my third time. The first time I was 13 when I was diagnosed with osteosarcoma or bone cancer. I had chemotherapy and I also had surgery to fix that issue. At the age of 19, I was diagnosed with lung cancer, which was a metastasis basically from the bone cancer that I had 6 years earlier. In the time between my remission then and now, I have completed an associate's degree. I hold a full-time job. I'm married. I have 3 wonderful children. And my most recent diagnosis came on March 9th of this year. I had been feeling this pain in the back of my leg since about November. Kind of followed it up and then I stopped. But once I finally went back to the doctor, he did a ultrasound right in the clinic, and I guess because of the mass that was there, he decided to do a biopsy that same day. He called me back on March 9th, which is a Friday, to let me know that the biopsy had came out positive. It was cancer. The technical name of it is myxofibrosarcoma. It's basically a soft tissue cancer. It's a tumor that's inside my thigh muscle. So everything since then has really been really hectic. I've already stopped working because I had a lot of treatment that I had to do first. I had to do an MRI. I had to do a chest CT. Here recently, I got my port placed for the chemotherapy, which I'm gonna start on Monday. Just the ball has just got to rolling since then. So I'm scheduled for 6 treatments of chemotherapy with adriamycin and ifosfamide. I'll be able to do those outpatient, which I'm kind of excited about because my previous treatments, everything was inpatient. I have to be in the hospital. So I'll get to go down to the hospital 5 days a week and get my treatment. I have like a 2-week break in between, and then I'll have another treatment for 5 days. My doctor is, my oncologist is Dr. Jonathan Trent, and he's from Sylvester. And then the orthopedic doctor who will be doing the surgery and everything is Dr. Temple, and that's who I've always worked with on my past experience, the past surgeries that I've had. Dr. Temple has done them. So I hope that this video could be an inspiration to others to always keep the faith, stay strong. I'm very spiritual. I believe that God has not brought me this far to leave me. I have a wonderful support team which consists of my husband, my mom, my grandmother, my sister, my children, and as time progresses, you guys will meet everybody because everybody really does play a very, very important part in my recovery, in my healing, and in my treatment. I guess I'm kind of excited to do the video journal because it'll be like the first time in letting other people see what I'm dealing with on a day-to-day basis. Some days are good, some days are bad, but I told my husband that I do think it's important for people to see every aspect, just so you know it's not gonna be over like just like that. It's gonna be good days, it's gonna be bad days, but with strength, love, support from your family, like you can get through anything. I've decided to be very open about this process. I'll be Facebooking everything. I'll be uploading these videos. One of my friends told me I should do a vlog. I don't really know what that's about, but I'll look into that also, because a lot of people we don't go to the hospital, we don't get treatment, and especially when we hear cancer, like, we just think that it's the end of the world or it's life-threatening. I'm here for the third time battling a very serious sarcoma, and I believe that there is a light at the end of the tunnel. I hope that I can be an inspiration to others. I hope that others will be encouraged as they watch my struggle. And I'm just open to reaching out to other people that have been through the same thing, that are going through something similar, just to make a connection and just to be supportive of each other. Again, my name is Felicia, and I guess you guys will be seeing more of me as the time goes on. Thank you.
Go.
Okay, so I'm here waiting for Dr. Temple to come back in, because since the biopsy last week Monday, it's just been hurting a lot, and I just want to make sure that it's not any bigger than it was. So he's gonna come in and take a look at it, and hopefully I can feel better. I'm feeling a little bit better, but we just want to make sure that it's what it was. It's not any bigger. If anything, it's just swelling.
All right, and what is it? What do they think it is?
Well, the doctors have said that it's a soft tissue sarcoma, which is some type of soft tissue cancer. Waiting on my oncology appointment, but tomorrow we'll be going to have an MRI done, and then Thursday a chest CT. So
Okay.
let's see what happens.
All right, so you just seen Dr. Temple.
Yes.
All right, which is the orthopedic surgeon here at University of Miami.
Yes.
All right, how do you feel?
I feel good. He said the biopsy site looks pretty good, probably some swelling. He's going to give me a stronger medication for pain. It's also an anti-inflammatory. We just need to get the ball rolling as quickly as possible, because basically the tumor has grown a bit since November. When I first noticed it, it wasn't as large as it is today. So Dr. Temple is pretty adamant about getting the ball rolling. Most likely I'll see the oncologist on Friday, and we'll kind of go from there. So I'm done here today. We'll probably have to do a first video to just take you back to the very beginning when we get home today.
Okay. And what did you think this was last year in November?
Oh, I had no
what
idea
happened?
what it was. It was just very strange, and unfortunately I do know my history, so I was trying to get it checked out, but I had no idea that it could have been this.
Okay. You feel pretty optimistic about the recovery and surgery and things like that?
Of course. I'm just ready to get it done, basically. Ready to get back to my normal standards of living, or better than normal. I got a lot to do, and I don't know how much time I have to do it, but I'm going to do what I can.
Okay. All right, high five. All right, Felicia, we will see you later.
All right.
Thank you very much.
Okay.